Today I will be talking about the 5 most common injuries in runners. The first is Achilles tendonitis, which is inflammation in the Achilles tendon, which is located on the back of the calf that runs up the leg. The symptoms are tightness and pain in the Achilles tendon. Also, there will be a loss of flexibility from the buildup of scar tissue, and the pain also may go down into the heel. This is caused by tight calf muscles that try to compensate by pulling onto the Achilles tendon. A good way to prevent Achilles tendonitis is to stretch out your calves by using heel drops. You will use a step or something like this where you can drop your heels off of. You will drop off each heel one at a time to stretch the back of the legs, and I will demonstrate. So you hold for a few seconds, and then you switch, and then that will stretch out the calf muscles to help prevent Achilles tendonitis. The next injury I will be talking about is plantar fasciitis. Plantar fasciitis is inflammation in the plantar fascia that is located on the bottom of the foot. It's right here. And usually the pain and symptoms are in the heel of the foot, and then they run throughout the bottom. It is worse in the morning because you sleep in plantar flexion and it keeps your Achilles tendon tight all night. The cause of plantar fasciitis is the Achilles tendon being tight and pulling on the plantar fascia and causing wear on it. It is also common for new runners because they are not using the bottom of their foot quite as much in the same ways. A good stretch to prevent plantar fasciitis is to sit on the ground with one knee bent and then to pull on the top of the toes, and that stretches the bottom of the plantar fascia. The next injury that I will be talking about is the iliotibial band syndrome, or the IT band syndrome. This is inflammation in the IT band, which is located right here along the side of your leg, and the symptoms are pain in the area for the first mile or two of your run, and then eventually they will loosen up and no longer be in pain. Some causes of this are anything that can cause your leg to bend inward, so if you overpronate, or if you're bow-legged, or if you wear worn-in running shoes when you run. A good way to stretch the IT band is to lean on an object, cross your leg over, and then push your hip outwards, just like this, and it stretches the IT band right here. The next injury is called chondromalacia, which is also called runner's knee, which is a softening of the knee cartilage underneath the kneecap. So it's right here. The symptoms that occur are pain, redness, and swelling in the area, and it's also not only under the kneecap, but also beside the kneecap. The cause is from overpronation of the foot or the quadricep being too tight and pulling the kneecap off of the track that it is gliding on. A good way to stretch to prevent chondromalacia is to pull the foot back and hold it, and then this stretches the front of the quad muscles to help prevent it. The final injury that I will be talking about today are shin splints. And shin splints are inflammation that is located in the front of the shin in the tendons, located right here. The symptoms that occur are pain and aching in that area and can often go away as you run because the muscles will loosen up. The cause of shin splints are the tired calf muscles that are pulling too much on the tendons located on the front of the leg. A good way to prevent this is to stretch, and I will show you a stretch. First, you're going to sit on your knees, and then you're going to sit on your heels, and you're going to lean back, and that stretches the muscles and tendons on the front of the leg.